Role of the government in health. In a democratic setup, the government works for the welfare of its people. The government looks after education, health, employment, etc. of the people. It also performs certain functions like development of roads, electricity, etc. Let us see how the government plays an active role in maintaining the health of its subjects. What is health? In 1948, the World Health Organization (WHO) defined health in their constitution as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Their Ottawa Charter for Health Promotion 1986 stated that health is a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as physical capacities. In recent years, this statement has been modified to include the ability to lead a socially and economically productive life. Health not only means to be free from diseases and sickness, but is also associated with nutrition, environmental health, social and mental health. We all want to be active and live in good spirit. It is not healthy to live a dull and inactive life. We also need to live a life without any stress and tension. All these are the various aspects of our lives as part of our health. Aspects of health. Physical health. Physical fitness means well-built and sound body health. Such a physical health is the result of regular exercise, proper diet and nutrition. It is equally important to take proper rest for physical recovery and maintaining good health. Mental health. Mental health refers to a state of emotional and psychological well-being of an individual. A mentally sound and healthy individual is able to use his or her cognitive and emotional capabilities, functions in society as well as meets the ordinary demands of everyday life in a better way. Determinants of health. There are 4 general determinants of health. Number 1, human biology. Number 2, lifestyle. Number 3, environment. And number 4, health care services. Health is maintained and improved not only through the advancement and application of health science, but also through the efforts and intelligent lifestyle of the individual as well as the society. Indian healthcare services. Healthcare in India is the responsibility of the states. The Constitution charges those states with raising of the level of nutrition and the standard of living of its people and the improvement of public health as among its primary duties. There is also a national health policy in India, endorsed by the Parliament in 1983. It aims at improving the general health conditions of the people by means of providing health care centers, dietary suggestions, etc.
Following points show how the medical facilities or services are increasing in India.
Number 1. The total number of hospitals has increased from 11,174 in 1991 to 18,218 in 2001. Number 2, the number of trained personnel, that is doctors and nurses, are also increasing continuously. According to data available in 2001, there were 1.25 million doctors and 0.8 million nurses in India. Number 3, according to an estimate, more than 15,000 new graduate and postgraduate doctors are trained every year. Development and availability of better healthcare facilities, reduction in poverty, availability of food and increase in literacy, etc. have all reduced the early death of people. While the birth rate is increasing, death rate is decreasing. As a result, the Indian population is growing very fast. The medical treatment has further provided the common people a good chance of leading a better life. Due to the rising level of health facilities in India, a number of medical tourists are coming to India for treatment. Public and private healthcare services. The health of a nation is difficult to define in terms of a single set of measures. At best, we can assess the health of the population by taking into account indicators like infant mortality and maternal mortality rates, life expectancy and nutrition, along with the incidence of communicable and non-communicable diseases. Healthcare facilities can be divided into public and private health services. Public health services. The public health services are the hospitals run by the government. All these hospitals work as a chain and provide treatment both in rural and urban areas. The care and treatment varies from common problems to special services. In villages, there are primary health centers which have a trained nurse and a village health worker. Primary health centers, PHC, cater to many villages in rural India. There is a district hospital at the district level. The most important aspect of the public health services is that it is open to all, providing care and treatment to even the poor sections of the society. Public health systems take actions to prevent the spread of diseases such as TB, polio, malaria, dengue, diarrhea, etc. The Indian Constitution directs the central and state governments to ensure the welfare of its citizens and provide healthcare facilities to all. The resources needed to run these services are obtained in the form of taxes taken from the public. As per Article 21 of the Indian Constitution, the government must safeguard the right to life of every citizen. Private health services. In the rural and urban areas, doctors run their own private clinics. Hospitals and nursing homes providing specialized services are also privately owned. Many laboratories that offer special facilities such as ultrasound, MRI, X-rays, etc. are also there.
Many chemist shops are also there from where we can buy medicines.
The private healthcare facilities are not controlled by the government. In private health centers, patients have to pay a lot of money for the tests and treatment. Therefore, it is not possible for the poor to get the treatment done at private hospitals.
They mostly depend on the locally available quacks or doctors in the area.
The health services in the private sector have developed a lot. Today, we have many big private hospitals dealing with various diseases. But they are costly. so the poor and weaker ones cannot afford these hospitals. Healthcare and equality. In India, we come across a situation in which we find that private healthcare centers are enormously increasing. These centers are concentrated mainly in the urban areas. Such services are run only for profit making, and the cost of the services provided is quite high. Only very few individuals who can afford the cost of such services go to these hospitals. While the Constitution of India states that it is primarily the duty of the government to provide healthcare facilities to all and ensure the welfare of the people, the question which comes to everyone's mind is why equal and adequate facilities are not provided to everyone. Is adequate healthcare available to all? The health facilities in India are not adequate or evenly available to all. The duty of providing equal health services to all its citizens and to the poor people of our country is with the government. Health depends on the basic amenities provided to the people, the social conditions they are living in, and on the healthcare services provided. Hence, it is important to concentrate on all the aspects of health to improve the health scenario of our people.